I don't know that we have a really good tool that identifies and can answer the question about the number of screenings that are going on in the schools. I will say a couple of things, specifically talking about Cincinnati Public Schools because of our strong partnerships. And that is that, one, there are 25 school-based health centers in the 55 schools in Cincinnati Public, and those providers for the children ages 12 and above are doing mental health screenings, the depression screenings related to the concerns, and also the ASPERT screenings that are asking the questions about drug and alcohol. So I know those are in place inside the school-based health centers. The other is that we have mental health providers located in every school in Cincinnati Public. So any child that there is a concern that goes to the mental health provider there, they are being screened to determine if there are any risks. And then there are emergency plans in place that the district has established that are monitoring as well and providing support. So there are those multiple sort of across the system pieces. Then individual schools have done some programming themselves because of concerns that the particular school has. And when we do that, we really work to make sure, and that's the thing I think I have to come back and emphasize, is anytime you're doing a screening, that we have to be sure that the resources for access to support are available for the students that need it. So we have to know that we can fully respond, and that's, to me, the most important piece. One of the things I think it's important to really emphasize is when we are planning a screening, a part of the planning process has to be being sure that we can answer every single child that is identified at risk. We have to be able to respond immediately to their concerns based on how high risk. If they're saying things that make us be concerned that they're thinking about suicide, we have to respond that day. We have to have the resources in place to make sure that that child that's now been identified and shared with someone what they're thinking about gets the help that they need that day.